All right, hey everybody, my name is Dr. Chris. Great to have you guys today. I'm with Intero Chiropractic, and we're just really excited to go over some things that are really important for a lot of questions I've been getting in regards to mothers going through the birth process and just trying to better understand and navigate their body and really the impact the pregnancy is having on the development of their children as well, so that they can have a healthier birth and actually make sure their children are developing as much as possible as well. So this is going to be kind of a series of videos, and for starters I'm just going to go off some of the mechanisms that go into actually leading to injury within children throughout the birth process, some of the different types of presentations the child can present as they're coming through the birth canal, and what that can lead to in regards to maybe signs and symptoms that they could have a structural issue, and some things that you can do about that moving forward as well. So some things that actually predispose mom, which basically sets the stage for making her more susceptible to having birth complications, could be it's her first child. Because the abdominal wall muscles are actually so much stronger versus women that have multiple children, their abdominal muscles become weaker, which actually creates more room for the child in the uterus. Another one could be that the mother has just a smaller framework. Now, that shouldn't by any means mean that the mother is limited to not being able to have a vaginal birth by any means. They should be encouraged to pursue their health goals and have a birth that suits their goals and what they want to accomplish. But that just predisposes them to maybe a little bit more difficulties or issues with constraint or injury with the child throughout the birth process. The other one could be uterine malformations. Maybe that the mother's uterus is not actually constructed or didn't develop like a quote-unquote normal uterus. So those are some common things. And when we look at the birth process, some of the major presentations, the most common one and the one that's ideal for mom and baby is actually called the vertex position. You might not be able to see this very well, but you can see that the baby is going face down, and the base of the very top of their head, it's called the vertex position because the very top of their head is pointed straight down towards the cervix. That makes it most efficient for the child to come out, and then they're able to wiggle themselves out of the birth canal when they're born. Now, when it starts to become an issue is when maybe the baby doesn't assume vertex position, and probably two of the more common forms of non-traditional presentations or ideal presentations would be the breech presentation and the transverse lying position. So if we look at the breech, this is when the child is not head down, they're not vertex down, and their feet are up, and this makes it much more difficult because through the process, when the child is coming through the birth canal, this can actually create a lot of stress on all regions of the spine and can result in numerous complications in regards to being like torticollis. There's even been studies showing children, I think it was 6,000 children were examined, and roughly half of those children had evidence of posture scoliosis that were breech presentation. The other one we look at is the transverse presentation. Now, this is actually more common in women that have had multiple children because what's happened is their abdominal muscles actually have gotten a little bit weaker, and because of that, the child is actually able to have a little bit more versatility in the position that they can assume, and sometimes they can assume this transverse position where they're up against the side. And so two of the major issues with these presentations is it puts a lot of abnormal stress on the neck. So basically the child can be bent down too much, or they can be in too much extension. And so when they're coming out of the birth canal, that creates a lot of stress on the ligaments, the discs, the joints, and all of the receptors that are sending good information through the nerves up into the brain and then they go back out to the body. But even in the vertex position, we want to be able to have that vertex going down. We can also have what's called a brow presentation or a face presentation where it looks just like this. The baby's going head down, but instead of the vertex going down through, it's actually the forehead or the brow or even the face, which again puts a lot of extension in the back of the head there. Okay, so 3 things that you as a mom can do post-delivery to actually make sure that your child is developing as best as possible and actually being able to pay attention, maybe some signs and signals that we need to pay attention a little bit closer, is really just be able to, see if they maybe have excessive crying, or maybe so that goes in line with being more colicky, or maybe that they just are only breastfeeding on one side versus the other, or they actually don't want to breastfeed at all. The other thing is they might not be having regular bowel movements. Children should be having multiple bowel movements a day. That's the body's way of eliminating toxins, especially as a lot of toxic buildup has occurred in the uterus throughout the birth process through their own waste products. So those are some things to pay attention to. Now, 3 things that you can do as mom to really ensure that they're developing as best as possible and help maybe overcome some of the issues that they're experiencing is making sure that they're getting adequate tummy time. I know a lot of parents have been kind of scared into thinking that, if there's too much tummy time, we run the risk of increasing sudden infant death syndrome. Just make sure when you're having the child on their stomach that you or your husband or the family is there just watching your child, and just start out with only a couple minutes a day. The goal is to really get them up to maybe 10 or 15 minutes, but that should be staggered throughout the day. The reason that's so important is because when the baby's on their tummy, what happens is it actually starts to stimulate the normal development of the curve in their neck. So you should have a nice forward curve and the neck like that. And when they lay on their stomach, their natural instinct is to pick their head up and look in the surroundings. So not only does that start to help the development of that normal curve in their neck, but it actually gives them an opportunity to develop their muscular system, and especially the neurological communication to the muscular system and their vestibular system and all of those other sensory systems as well. One thing you can do, which is another tip throughout the pregnancy process, if maybe there's concerns that your child may be in breech presentation or transverse lying position, is actually having yourself lay down on your back on the ground, almost like if you're in a sit-up position. So you're gonna have your feet flat on the ground and your knees bent, and what you want to do is place a pillow to elevate your pelvis up. When you do that, that actually starts to encourage the child to maybe reorient itself into the more favorable vertex position. You can do that anywhere from 10 to 15 minutes a couple times a day to encourage the child to assume a more optimal position. Another thing, and probably one of the most important things you can do as well, especially after the child is born, is maybe you haven't noticed that you've noticed they haven't been sleeping very well, or maybe just, like I said, they've been colicky, they've been crying a lot, or they haven't had regular bowel movements, or they haven't been breastfeeding at all, is actually have your child's spine examined by a neurologically and structurally based chiropractor. Because a lot of times, like I mentioned, with these presentations where they're going breech, or they're in the transverse position, or in the brow or the face position, it creates a lot of structural issues within the upper part of the neck, or even all the way down in the tailbone too, in the pelvis. And so what happens is the brain's not able to send the right messages down the spinal cord and the nerves to the muscles, allowing the child to actually turn the head and feed appropriately, and also the nerves coming from the tailbone that go to the colon and actually are pushing toxins out and making sure that they're having regular bowel movements. So again, I hope you guys found those tips really useful. This is just the first part of a series of videos I'm going to do in regards to giving mom a little bit more ownership and empowerment through the birth process, and making sure that they're having a healthy pregnancy, and also the child is actually having the opportunity to develop as best as possible. See you guys next time.